Did you know endometriosis is one of the leading causes of female infertility and affects 24 to 50% of women with infertility every day?
It is one of the many conditions that can impact women regardless of socioeconomic factors like race, education, or employment.
That's right. Back in the studio with us today to discuss endometriosis and some of its causes is Dr. Stephanie Hack. Thanks so much for joining us.
Thanks for having me.
Okay, so Dr. Hack, tell us a little bit about what endometriosis actually is and how do you actually get endometriosis?
Sure. So endometriosis is a chronic inflammatory condition. But basically what that means with this condition is the tissue that's inside the uterus doesn't stay inside the uterus. It actually travels to other places in the pelvis.
And I know I have a close friend of mine who actually has endometriosis, and I remember that once a month during her menstrual cycle, it could be pretty rough on her. Talk about how it affects women every month.
Sure. So the primary things that people experience are going to be chronic pelvic pain and really painful periods. And that's kind of a cycle with the hormones and the inflammation and some other chemicals the body produces like prostaglandins. But all of this works together to really cause a lot of pain. And then whenever you have inflammation in the body, that can also cause a lot of pain.
Yeah, and can you kind of talk about some of the additional causes of endometriosis and what are the known risk factors?
Sure. So there are a few primary theories, specifically 4, but the main theory is something called retrograde menstruation. I know it's a handful of words, but during the menstrual cycle, when a woman is menstruating and the blood would typically come out of the uterus through the vagina, instead it also goes into the fallopian tubes and out into the pelvis. And so that's the primary theory that we think is what causes endometriosis. And there are some other theories that are a little more complicated to explain. And then the risk factors. So one of the things that we know is there is kind of a familial association. So if somebody in your family, like your mother or your sister has endometriosis, then you are at a higher risk for endometriosis as well.
And does this affect fertility?
Yes, for a few reasons. One, the inflammation. Very early in the disease, if somebody doesn't have a lot of endometriosis per se, there's still the chemicals that are released because of the inflammation, and they can cause damage to the DNA and sperm, and they can also cause damage to the ovaries as well. And then further along, as the disease progresses, you can get a lot of scarring in the pelvis because of the inflammation. And so, one thing with ovulation and getting pregnant, where your fallopian tubes and your ovaries are really matter. When they're scarred in different places because of endometriosis, it changes your pelvic anatomy, and that can also lead to infertility.
Is there a certain age range of women that get endometriosis over other ages?
It's just women of reproductive age. Mm-hmm.
Gotcha.
And let's talk about the stages of endometriosis.
Sure. So there are 4 stages. I don't want to mess this up, but I think it's minimal, mild, moderate, severe. And that's really going to depend on where in the pelvis the endometriosis is found and then how deep the tissue has grown into the organs in the pelvis. And the interesting thing about it, which I always found interesting, is just because you have stage 1 doesn't mean you can't have a lot of pain. And just because you have stage 4 endometriosis, which is the most severe, doesn't mean that you'll have pain. It's really interesting. So the degree of endometriosis and the level of pain you have aren't necessarily correlated. And then furthermore, I forgot what I was going to say.
Tell us a little bit about how endometriosis is actually diagnosed.
Sure. So we go by your physical exam and what the person is saying, their medical history, their complaint. But really, to ultimately know if someone has endometriosis, we need to do a tissue biopsy. And that is typically done during laparoscopic surgery.
Gotcha. All right. Thank you so much for joining us today.
Thank you.
You're welcome. Thanks.
All right. For more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.